And real quick, guys, real quick, another important thing that we need to know. When you walk into your x-ray room, you always want to kind of have an idea of which side of your x-ray tube is the anode and the cathode. Most of the time, the rooms are already set up with that in mind. But for now, since we're getting used to looking at all of this, see if you can identify where on the x-ray tube the anode and the cathode are, okay? You'll see that both of these machines have been neutered. They will not shoot x-rays, no matter how hard you try or wish. Neutered. They took it all away. No, we don't have anything that shoots now. Because we don't have any lead shielding. Yeah. That's my next thing that I'm pushing for, an actual working room. Okay. And one distinction about this X-ray tube is that your setting of your X-ray tube will only be accurate if that table is at the maximum height. Okay, so keep that in mind for your positioning. Yeah, it needs to be up as high as it can go. Landscape is also crosswise. Portrait is lengthwise. Okay. That is your longitudinal travel. That's a terrible Bucky too, Nor. Sorry. It's a finger pincher.
By the way, guys, this is like very expensive, so don't drop
Also, real quick, since we're still getting used to things, this is the IP. This is the photostimulable phosphor. Okay, so this is a CR cassette, which is very different from this, which is an old film screen cassette that I just broke. Okay, that is the intensifying screen for this 10 by 12 cassette. So we would put an actual piece of polyester film in here and expose this, and the screen would expose the film. This is a CR cassette or PSP cassette. Boy, I'm really quick on my reflexes today, though. Okay, and you guys can take a look at any of this stuff, okay? There we go. Sure. I usually work with the other one. Okay. I love the sound of discovery. Ah.
Hey, you gotta remember correctly. Yes. And I'm gonna think you taught us wrong. Shielding. Opening, finding your shield. And then go like this. Take a deep breath in. Maybe like hold it. Shoot. Wait, they want to try?
Are you guys all done with that X-ray machine? Everybody been through? Okay. All right. Okay. It is. That's an oblique hand or finger sponge. Let me show you where 72 is. So right here,
Is there like something?
super high-tech piece of electrical tape.
Cool.
This is 72 inches. All right, folks. If you guys are done over there, you can come over here. We're going to get into our positioning for the chest, okay? All right. What is the SID for a PA or AP chest? 72. What is the SID for a lateral chest? 72. Why do we do preferably a PA chest and a left lateral chest? Trick question!
The heart.
Hell yeah. Absolutely. The heart is more anterior in the chest, right? So we do it PA so we can reduce the OID of the heart. We do a left lateral for the same reason. The chest is more, or the heart is more on the left side. We get it as close to the bucky as we can, okay? What is your CR centering for a PA chest? Just so good. It makes me so happy. All right, so we're going to center to our bucky here. I set all of this before I bring my patient in optimally. Maybe sometimes I won't know what my patient looks like. They might have, a really broad chest. And when I go out to the x-ray or to the waiting room to get them, I'll notice that they have a broad chest. So maybe it means I'll need to change the orientation of my cassette from portrait to landscape. Okay, it's one of those things where we just have to be mindful of body habituses and remember how lungs can change depending on someone's body habitus. Okay, help me with your name. I'm so sorry. I'm going to get it eventually. Victoria. Victoria, I would probably have my cassette portrait. Okay, if it's someone who is larger body habitus, not necessarily obese, right? Then I might have the cassette in crosswise because I know that their lungs are not going to be as long. They're going to be wider and broader at the base, right? So that's one thing. Second thing that I do is I go ahead and pre-mark it, okay? If I have my left marker ready to go, drop it up there, which reminds me I need to get you guys your markers because I don't think we have those in here. What else did I want to say? What is your breathing instructions for a PA chest? Yes. Yes. So, how does that sound? How's that going to sound when you're giving your instructions to your patient? So, real fun fact, real quick. You would be surprised how few of the general population know what the word exhale means. Okay? So when I say in my lecture, dumb it down, keep it really, really simple, I mean dumb it down, keep it really, really simple. Take a deep breath in, blow that breath all the way out. Take another deep breath in, hold it, don't move, don't breathe. That's exactly what I've said for 20 years. Okay? Nothing changes in that. And there's no ambiguity there, right? You can't confuse that, right? Let me have a mock patient. Who wants to be my mock patient? A lot of hands. Whoever's closest. Come on over. Yeah, come on over. All right, so first thing I'm going to do. Hi, can you tell me your name and your date of birth? Excellent. Do you know what we're doing today?
No.
Great. I'm going to do 2 quick pictures of your chest, okay? So if you will, I've already had her change. She's not wearing a bra. She's wearing a gown. Any chance you could be pregnant? Great. All right. So if you will, come right over here to my x-ray board. Put your chest all the way up against that board. First thing that I do. They have no idea what they're doing beyond that point. They're just where I need them to be in the room, okay? So now I'm going to start basing everything off of that, all right? First thing I'm going to do, palpation. Palpation is simple. Palpation is not invasive. What do I mean by that? I don't walk up to her and go, okay, sorry, nothing intended, okay? Well, yes. So I'm going to get to that point, all right? I am going to find where I need to be centered for my x-ray, so you're going to feel me touch your back, okay? Simple! T7, right there. Okay? And then Boom. Okay? Now you're going to feel me put my hands on your shoulders. Okay? Roll those shoulders forward. Put the backs of your hands on your hips. Ha! Great. Roll those shoulders forward. Great. We did not have her do this beforehand. Most of the time, too, these lead shields will have kind of what's called a tension band on them, so they're very easy for you to pull open and just go, beep. Okay? So we did, for our purposes right now, we did put a shield on her. Okay? I really want to make sure those shoulders are rolled forward. I want to make sure that chin is nice and high. Why do I want her chin to be high? We don't want her chin to be in the apical region of her lungs, right? I also don't want her head tilted too far back, so it's a delicate balance between the two, okay? So just make sure their head's not tilted too far back and their chin's not too far down. Yes?
When you say T, obviously at the T7 level, right?
Mm-hmm.
Okay.
And you can relax. You were great. So the book also specifies this method, right? I don't know what method you use for finding your centering for a chest. Do you use that? See, I don't. And I'll tell everybody the reason why. You can absolutely do it that way. That is a permissible method. Obviously, it's in your book. The method that I use, I feel like, is a little more specific to each of my patients, okay? Because my hand is huge compared to Victoria's hand, right? So my distance between here and here is going to be longer probably than the distance on her hand. So for me, I get more specific with each patient because T7 on every patient is going to be at the same level at the inferior angle of the scapula, which will be specific to that patient, right? So I always, let me turn around, feel inferior angle of the scapula, and I know that for Victoria, that's the center of her chest, and it will be different for you and everybody else, okay? Could that work? Sure, probably, but I don't know that it will work as precisely for every patient, so I don't do it that way. But you do whatever you feel comfortable with. Again, it's in your book, okay? Let me have you turn around one more time. So she's shielded. She's got those shoulders rolled forward. She's got the hands, right? We are centered where? So we're on T7. Great. What's the other thing we need to worry about with our centering? What other centering point do we need to be on? Mid-sagittal plane. Absolutely right. So I'm going to move her hair slightly. I'm going to palpate her spinous process on her T-spine to make sure that she is nice and centered. Okay? So we're good. Collimation looks good-ish. We're going to refine it because we've got a cassette in their portrait. And she's not a large lady. So we're going to bring that collimation in. She has a shield on. I am making that distinction very clear that I did not forget. Okay. Everything look good to you guys?
Not your marker.
Why not?
Because it's not there.
It is?
Oh, I didn't. Oh, that's what that's sticking to?
Mm-hmm.
Oh, my bad.
My left.
Specific level.
Sorry, I marked it incorrectly too. It should be, the top of the cassette should be about 2 inches above the top of the shoulder, which, again, she's tiny, so that's why I collimated in even further, okay?
Also, that's when we use a collimation.
Mm-hmm. Yep, you got it. For like a larger, more average sized adult, no offense, Victoria, you could probably keep the collimation open a little wider, okay? Can I have somebody open that door for me? Just a second. Great. So we're centered. We're ready to go. What is the instruction now? And give her that instruction for me, please.
You said to, I'm gonna take 2 pictures of your chest, and you said to take a deep breath in and blow it all, blow it out and do it twice, and then the second one you hold.
So give her the instruction. This is what we're here for, right?
Okay. Go ahead and take a deep breath in and blow it out, and then you're gonna take another one for me, and before you blow out, please hold.
Right.
Yeah, good.
So simplify it even further, okay? Because, and I'm telling you this because people, when they're in this moment, they go to a different plane of existence. They're like freaking out, right? Take a deep breath in, blow that breath all the way out. Take another deep breath in, hold it, don't move, don't breathe, and you watch them until they finish going. When they stop moving, bam, X-ray. you can breathe. Okay? Don't forget to tell them to breathe. Because if you do, I kid you not, they will stand there until they're blue in the face and pass out. Okay? Questions?
We're giving this behind the console, right?
Yes, yes. So this is the moment where everybody makes fun of us, where we've said everything and we're like, you get the radiation, not me, right? Questions?
I have a question.
Yeah.
So when you put hands on it, can also like put it around.
You can. My criticism of that is that the shoulders don't roll as far forward when you do that, okay? So if I have you put the backs of your hands on your hips and then go, those scapulae are now way outside the lung fields. If you just hug it, there's a risk that they could kind of drop back down a little bit, okay? Questions? However you do it whenever you graduated, you become a tech, that's on you. I got to teach you the book way. Questions? And you'll also find when you get out of this program that most techs just do a chest x-ray on what? One inspiration. Why? Because techs can be lazy and they are worried that if they have a patient breathe on the second breath, that their lungs will go outside of their collimation and then you'll have to reshoot it. So they're like, if I just do it on one, the inspiration won't be as big. So it might not be off my film. Right? Questions?
I got a question. Probably unrelated, more related, but so you work in a pretty busy hospital, say trauma or something. How do you have a certain amount of time to like image patients?
No, you don't have a certain amount of time to image patients, but there is a reasonable amount of time that it should take for you to finish an exam. Okay? For me, and that probably for Nor too, we've been doing it for a little while. It probably take me about 2 minutes to do a chest x-ray. If that. Right?
With the perfect patient.
With the perfect patient, yeah.
Which brings to my next question. Say you have someone to come in with like burn collarbone or like something broken or like nasty. We have to clean that obviously, right? Oh,
We don't clean that. No.
Like blood, something?
No. If they come in through a trauma, we typically have to wear PPE and make sure that we don't get it on us, but we're not responsible for like that kind of cleaning of a patient. Now, if they're like bleeding all over your x-ray table, yeah, you have to clean that up. We don't let them bleed and then call environmental services, because then environmental services would hate us.
I would also like to say it should also take you pretty fast to do a trauma as well. Because sometimes you get called in for a blue, which there's a million people in the room and the doctor's staring at your screen. So you got to do it quick.
Yeah.
Or you get yelled at.
And that's also why, good point, when you're in a trauma, that you are very good at your imaging. I would say that the best techs I know are the ones who have been in a rotation in the ER for a significant amount of time and have gotten used to doing traumas, because you got to shoot it right the first time, right? We've got somebody who was in a car accident or, whatever, got caught in a boat propeller. I've seen that. We have to get it right the first time. Why? Because everything else that they are doing for treatment is kind of waiting on us sometimes, right? If they're waiting on a chest x-ray, that patient can't go to CT. If they're waiting on a chest x-ray, that patient can't do whatever other intervention they're waiting on, okay?
Also, the patient can only hold still for so long. So you want to do it quick.
Yeah.
If they're a broken foot and you're putting them in an ambulation, they're going to hold it for 1 second. And if you miss it, you miss it.
And peds are even worse.
Oh, yeah.
Yeah, a lot of tape in peds. Questions? Okay, let's do a lateral real quick. What's your centering for a lateral?
Coronal.
Mid-coronal, yes, T7, great. Let me have you raise both of your arms up, bring those elbows together. We're going to keep the elbows up. One more important distinction here is she looks like she's pretty well positioned, right? Wrong! Separate your feet a little bit for me. And separate that one, move that one over. Now stand up straight and step into my bucky for me with that left foot. There you go. So I don't want anybody leaning, because that changes the orientation of their chest, right? I want them as close to my bucky as possible so that everything is in the same plane. Keep those elbows forward, raise up. Great. I don't want the arm to be over any of the lung field, right? What is the one change that you make when switching from a PA to a lateral on your CR? Down 1.5 to 2 inches. Okay? And then find your T7 first, and then we're going to lower just a little bit beyond that, because not the position, but whenever you switch somebody from PA to lateral, we see more of that posterior dimension of the lungs. That costophrenic angle goes down much further. Okay, so it's not uncommon to have to go down a little further on a lateral. Okay, second thing I'm going to do, I put my hand on one of the elbows and put one hand on their back to make sure that their back is completely perpendicular to the bucky. Okay, shield is still on, but the distinction is that I'm going to move it from here to here. Okay, marker doesn't need to change. It's still good to leave it where it was for the PA as long as we used it left. Great. Hold that chin up, take a deep breath, blow that breath all the way out, take another deep breath in, hold it, don't move, don't breathe. Breathe. Okay?
You need a button that does that.
I know. I know. I really want the sound effect as a text tone. I'm going to see if I can find one of the students at one of the sites to give me that GE sound. Questions?
Oh.
Anything to add?
I'll add right now.
Go ahead.
If they can't lift their arms up, what would you do then?
Great. Best you can. Right? Oftentimes, let's pretend that Victoria is a 90-year-old woman. So sorry. She has badly arthritic shoulders. Sometimes, best she could do is about right there. Okay? What do I do in that situation? Am I going to keep trying to force those shoulders up or those arms up as high as they can go? No, because I might hurt her. If she's got osteoporotic bones, I might break something. So we do the best we can. What you will find moving forward is that a lot of X-ray imaging is simply that, doing the absolute best we can in sometimes impossible situations. Okay? Questions?
Continuing on that, post-heart surgery, they cannot lift their arms. They're not allowed to.
Yep.
So this is the best that you're going to get.
They have their chest sutured
Also,
together.
the positioning of a lateral can change very quickly if you do the breathing instructions. You have to warn them about the breathing instructions, because when you're in a lateral, you fix it perfectly, and then you tell them to take a deep breath in, and then they start moving or leaning, that will change your entire. So you want to let them know, you want to stay in this position, take a deep breath in the exact same position. Don't lean, don't move forward, don't do anything. Just stay in that position.
Questions?
Is that because they're not leaning against or like having that?
Yeah.
You know what I'm talking about?
Yeah, because you're on your side. So once you're like taking that deep breath in, I just reach forward, so that in itself is. But when you're against it, you can do it.
And you feel there. Yeah.
Excuse me. Okay, folks, let's have about 12 of you go to one of the machines, and half, or the other half, go to that machine, okay? And I want you guys to pair off. I need a patient and a tech. And you guys start practicing this positioning, okay? We're going to be here wandering around helping you guys. You already know where the centering is and the SID. So let's get comfortable making mistakes, okay? Nobody expects perfection right now. Important distinction, right now.
When we're doing the lateral,
Yeah.
we're trying to get the distance. Is that marked on the bottom as well?
So 72 is up there on this
Oh, I
one.
see.
Okay.
Yeah.
Okay. So let's do an 18.
Cool. I'll be back in 2 seconds. I'm going to see if their markers are here. Excuse me, folks. Do we have their x-ray markers?
I do.
And happy belated birthday.
Thank you.
Priscilla.
Oh my goodness. If you got me like our card. Is it for the morning one?
Yes.
Okay.
Like for afternoon 1.
Okay. I think you should take all of them and then to everybody's.
Okay.
Just make sure to just double check it.
Sure. Awesome. Thank you.
No.
Okay. Excuse me, folks. We're going to do this real quick, actually, too.
And then what's the marker? The right marker?
It could be left or right. Yeah.
Well, that's a cool pen.
I'll put the left on the left side.
Easiest thing for a chest X-ray series, though, is to just use the left for the whole time. Then you don't have to switch markers or worry about putting the right marker.
Techs always lose their left marker because they're always using their left.
True.
Your right marker will always be on your badge, but left will always be on a patient.
And that's because it's used more because of the magnification of the.
No.
Or is it just because it's used?
But you rarely would use it. Well, you can use.
Wait, stand still for me.
Sorry? Yes. It does keep shutting off. This one's a little sticky. You will find that that is true for the real world as well.
So I feel like that's pretty. I thought that looks good, or maybe I'm not.
Excuse me. And you guys can ask me a question if you need to. I'm just going to be organizing your markers, okay? Okay. Ji Young, you are the first one that I see here. These need to stay on campus, okay? So at the end of lab, hang your markers here, okay? Or here. I don't care where. But you can keep them for the lab for now.
Oh, I see. So it's essentially
Dimitar Matev. These need to stay on campus, okay? Oh, Dharma's in evening class. Isaiah Manding. Oh, great. All right. Cesar Alvarez. Welcome. You sure you leave those on campus? Carissa Fong.
Go ahead and take a breathe in.
Carissa. Okay, thank you.
Breathe in one more time, hold your breath.
Marianne Perret. There you go. Thank you. MTF. That's who that is. April. Oh, that's Andrea Perez. Excuse me. Andrea. April, I'll get you in just a moment. There you go. I saw AP and I was like, hey, that's a great X-ray tech initial. And none for Gretchen Wieners. Bye. Caterina Elpino. Cat, got it. You're welcome. Maya Arzola. There you go, Maya.
You don't want to shoot that until you question why they ordered the chest X-ray.
April L. Lopez.
You're going to see chest X-ray for.
There you go. Kayla Mellow Nut Nut. Hello, thank you. Yes.
Yeah, so you would call. Oh, okay, before you bring it to the patient.
Victoria Fan.
Well, you want to question the patient.
There you go, of course.
You guys get a sheet or something? Yeah. Okay, so
Joy.
it'll say chest X-ray for.
You're welcome.
You want to call for your physician and be like, why are we
Estrellita. Estrellita Lermas. There you go, of course.
Because you might experience patients who don't speak English. You want to advocate for your patient.
Vivian Chavez.
I know.
Vivian, thank you. Josh Paulo.
Yeah.
Thank you, Josh. Christopher Pooh. There you go, Chris. Kumi Oka. Hello. There you go. Of course. Ennio. There you go, Ennio. Please. Yes. I mean, we do wear them around our necks. Yeah, when I have a lanyard, I keep it on the back of my badge. Yeah. Yeah. Christopher Ledesma. And Carissa Fong, I gave you yours, right?
Yeah.
Okay. Isaiah Manding. Great. Excuse me. Yes. That's what I use. Yeah. Like the poster putty.
Yeah.
Yeah.
Is that for lab?
You can use it for the lab,
Yeah.
but we've also got this stuff
Oh,
available.
yeah.
We've got two kinds of tape here if you want to put it on your markers. Okay. These are really sticky. This is just transport tape that you'll see a lot of techs use. They just wrap it around it. Both. No, they're not magnetic. Both of these are here for you if you want to use them. Okay.
When we're doing a PA, does this need to go on the left or the right?
No. If you're doing a PA, it needs to go on the patient's left. Okay. If it's a left, if you're using a left marker, it needs to go on the patient's left. If you're using a right, obviously it goes on the right.
But you have to do the left first.
Left lateral. But you can use either your right or your left for a PA, yeah, or an AP, okay? Because you can see both sides at once, right? Let me help you with that too. I didn't give you the overview on this. It's not great. Sorry. So it's really the worst Bucky I've ever seen in my life.
I'm telling them this is not what you'll be working
No,
with.
you'll be working with nice stuff.
Yeah.
But we all had to learn on this. Excuse me. Questions over here. How we doing?
For left lateral position,
Uh-huh.
for the market and air is the anterior side or posterior.
It doesn't matter really, as long as it's on there. You'll see there, and that you'll probably see some techs who want it to be on the front.
Yeah.
You know, as long as it's on there.
Yeah,
I'm
it's
overlearning it with
Yeah,
you have to
anterior.
choose the right side.
I
So
don't.
it doesn't matter.
Yeah.
You can. I mean, if it's a left marker because you're doing a left lateral, I don't care if it's back here or up here. You probably have more room if you move it to the front, though. Okay, make sense? Excuse me. Sorry.
Hold that.
And let's check here. Hold on one second. So hop back over here. Put your chest against there for me. Okay. Put your hands on your hips for me. Roll those shoulders forward. I want you guys to get used to actually helping them roll their shoulders forward, okay? Obviously, we would not be doing this on a 10 by 12. I do think, though, maybe just a little higher, okay? Top of the cassette, 1 to 2 inches above the top of the shoulders, okay? Let me get that fixed for you. Okay, that feels better. And you can open your collimation up a little bit more, too. From top to bottom, perfect. Okay, as long as we are centered there. Let's see, let me have you lean a little that way. Drop this arm for me. There we go. God, I'm hot. No, it shouldn't be. I'm gonna have to see if I can get somebody to come do something about it. 'Cause that's, I know, God. Hope it gets fixed before then. Yeah.
On the width size, you want that the light to be shown on the IR?
For this, I'm gonna be honest with you. For a chest X-ray, unless they're like a really small person, I don't do a whole lot of collimating because I don't want to clip the sides of the chest. I don't want to clip the apices or the costophrenic angles. So if my cassette is in there crosswise, I probably won't collimate much. If it's lengthwise, I might move it up a little and bring it down just a hair so I don't have as much abdomen. But typically, I don't really do a whole lot with it.
And then for the trim part, like how far out? You said like.
Just about right here.
Okay. Would you have them do that before or after?
Usually, when you put them in position, they will automatically kind of go, yeah. Because otherwise, their face will be right into the bucky.
Can I ask you a question?
No.
Before I forget?
Yes.
I keep on going like this. I gotta remember. But she said it was 9. I was like, well, I have to ask. So this week, I know last week we had like all week to prep for this week, and it was all great. We didn't have left. Now this week, are you opening all the stuff for next week? Okay. Today's Monday though.
Mm-hmm.
So are you doing that today?
I will probably, I mean, I have the lectures ready. I don't want to get too far ahead, but I mean, I can open next week.
With what I read, some of the announcements, or 90% of the announcements was like prep the week before the next week. So
I'll do that just because of the setup of this and because I do want you guys to get prepared ahead of time. I'll open it up for you guys.
okay, I was just
Okay?
wondering.
Yeah.
I mean, not saying I'm gonna do it all today or anything, but
No, if I open it today, April, I better see you in there.
I'll go in there for 10.
So that with an eye. Can I go see if they have the right name tag? What about right here? She also looked into the diaphragm.
Sorry, guys. Got tied up doing markers. So we're at 72 inches, yes? We are detented to the center of that wall, Bucky, yes?
No, because we're not doing it.
Let's see here. There we go. Feel that, okay? There's a little click and a little drop into a little track there.
This one is this one. Oh, yeah.
Remember what I said about people moving it without pressing the button? Now she's beating up my machine. I'll see if I can get that fixed. They have to like WD-40 it every year. It's the same kind of, you use the same kind of motion that you would use on an infant CPR. So we are not centered to the bucky. How do I know that? because I got light here and right here. Yeah. So get used to feeling that, okay? So go in, press this one, okay? Put your hands on it and feel that. There it is. You hear that? So now when we hit that light, I think you were right. It's just a terrible x-ray tube. There we go.
If they can't remove, you're gonna ask them. They can remove if they have.
I gotta see if I can get that lined up more. You're good. You're good. I think you're detented. I just think this x-ray tube is way out of alignment.
Have you inhaled first? Take one big inhale.
So remember, they don't know what inhale means necessarily. Take a big breath in.
Big breath in, and then blow it out all the way out. And then I'll have you take another one. Inhale in, and then hold, and I'll take the picture.
Great. And don't forget to tell them, hold that breath, don't move, don't breathe. Okay? Because if you don't tell them not to move, they're going to go, you taking it now? Okay? 2 tips for you, okay? Make sure that your patient rolls their shoulders forward, okay? Also, I don't want to see this light up here, okay? So let's bring that collimation down to the size of the film, okay? Great. Centered on the MSP. Money, where's your marker? Don't forget, get used to putting your markers on there, okay? If you need tape or sticky stuff, it's over there. Be sure you're throwing a marker up there, okay? And you put a shield under too, right? Great. Next. Noah, I'm going to give you this since you're where she's been.
Oh my god, I've been covering the camera. I'm so sorry.
It's just for you. Like, no one's gonna see. Like, Google's it, hopefully.
It's just for her channel. Just for the gram.
Are we making the money for it, or?
That's what she said. She's like, yeah,
Content creator.
yeah. I was like, and I can have step forward.
If they can reach it, they can. That's why they put that little thing up there, yeah.
Okay, well, I can only go down so far with you.
Oh, the positioning is beautiful though.
I can't go down any further, but I'm gonna touch your.
Does this bed go down?
No, I think he said this one doesn't, but that one does.
Oh, okay.
Okay, so we're just gonna pretend it's a little bit lower. Because
That's where you're
she's a little shorter.
Are you gonna shield?
Huh?
Are you gonna shield?
Yes.
So you were right.
Try to shield before. Try to have the patient shield themselves.
Oh,
It will save you from a lot of lawsuits.
Yeah.
Yeah, so exactly like she just did.
Okay, so do that before I start doing that, or while I'm doing this.
Have her step, or like have her just.
Gotcha. Okay. Let's try this one more time and make sure you're in the center.
What we're doing is refining your process.
Oh, that
So
looks.
assess this all before you
Well,
bring
it's
the
not gonna be
patient in.
exact
Then
because
make the adjustments based on
it's
the
a
patient.
little high.
Okay. This will be lined up before you ever bring the patient in. Okay.
Would you have them like come in to like measure?
Step to the.
We don't have to measure an eyeball of it.
We're just gonna. This is all set up before I ever run anybody in. Then I'm gonna grab my patient.
Now you're gonna take a deep breath in
Come on.
and then breathe out
So we're gonna do as
completely,
much as I
and
can
then take
set up
another deep
before I
breath
grab
in,
the patient, okay?
breathe out,
As
and
we
hold.
see, you know, it's a little taller.
So I would just say have her roll her shoulders
Oh, I
forward.
forgot to have on your shoulder, on your hips and lower
Yeah, you told me about that.
I know.
You should have remembered that.
It's in the moment. Thank you. And I can't tell your results. Oh. I don't know.
Markers there, shields on. Take a deep breath in, blow that breath all the way out. Okay. You can relax. Tia's blue in the face. You're good, Tia. Thank you. Questions on that? And you will find that there will be some exams where you will maybe set up more once the patient's in, but always try to do as much of the lining up and setting up as you can for the patient. Because if I'm a patient, I'm already nervous. It's just, they start asking questions, but also it's hard to like, I don't know, there's something about sensing professionalism that comes with like having so much of this ready to go. So that all I have to do is, oh, great, so what brings you in today?
Ideally, right, everything would kind of be pre-set up, or you would try to, so when they first come in, you would do the shielding first.
Everything is already set
After all
up.
the introduction and everything.
Yeah,
you do
yeah.
Shielding first.
Yes.
And then what would be your checklist after that?
Access.
So everything should be
Set up.
obviously like
Yeah.
checked off, right? Like SID.
Yeah. So typically what I do is I set up my room. I go get my patient. I bring them into my room. I say, my name is Nora. I'm going to be the x-ray tech. We're going to be taking 2 images of your chest. What's your name and date of birth? And then they tell me that. I give them the shield and I tell them exactly how to do it. Then I have them go up to the board and then I explain everything to them. I don't even touch the patient. I just explain it to them. Yeah, just try not to touch them. And then
And then would you check if
So let me
There's 2 of
see if
them.
I can provide some clarity here.
One
Okay.
does one way and one does the other way.
Sure. So remember, when we send something to the radiologist, it needs to be in what orientation? Anatomic, or it needs to be as though the viewer is looking at them, right? So, for example, if I shot Victoria, PA, right? You are Victoria, right? No. So sorry, I'm gonna get by Victoria. So what's your name? Kayla. If I shot Kayla, PA. My left marker would be on her left side, same as me, right? The image would then look like this.
more to the left.
Process, right? The PA though.
Wait, can I have you step to the side?
Like this,
Over here.
so that her left is on my right. And now the L is backwards.
Or is it just me?
So PA
Go bring it down.
or chest or abdomen.
So right there we're straight, right?
Okay.
It is displayed correctly. Okay.
And then just go put your chest on the board.
So already I feel like you're off the MS.
Okay, now bring it up.
Can you see?
Jihan, you were made
Yeah,
for
yeah.
a patient. Okay. Shoulders are good.
I'm following you. So go to however high you want to go. And I'm following you with my board.
Oh, for the bucket.
You're up here at this point. It's too high.
Great. Be sure it's in the light field.
Bring your arms down. And then go against the board.
So that's what you mean by like setting up beforehand?
Yeah. Yeah, a lot of the times though, you're gonna have to still adjust, but you just want to have everything in the room. Sometimes you won't even have the shield in the room. Sometimes you know. So just make sure you can detent this and then go get the patient. You know?
Right, because if you would have had it, it would have been like good.
Yeah.
I just thought it was more left, that's why. Like this. That's why I thought it was off. But it's. Okay, you hurt me with the shirt as well, yeah. Yeah, he's hitting me. Yeah.
Yeah.
The shirt. But it's aligned, so.
So I feel like I want to take
Mhm.
here.
Okay, just roll your arms forward for me.
Oh, wait, say that again?
Roll your arms forward for me
Oh,
and
sorry.
put your chest to the board.
Got it.
Okay. I'm gonna take 2 images. Breathe in. And then exhale for me. And then take another deep breath in. Hold it. Don't move.
So you can instruct the patient on the board, and then there you make the correction.
Yeah.
If needed.
Yeah.
So what are the main corrections that you check?
Wait, what are the what mean what?
The corrections typically you would have to do.
Sometimes you'll get the patient and they are huge, so then I would change the size. Yeah.
Or either the height or
Exactly, and the height, like you said. That's about it. Also, some hospitals are, when you move that, this also moves. Like when you detent it. So this is just very old school.
Yeah.
But it will be a lot easier with like a newer. Yeah. Yeah.
But the X-rays are very repetitious.
Wait, can you turn the light on? Yeah, that's good.
That's why you're going to be able to not have to.
Yeah, I would fix the collimation inward because you want to not bring her arms. Have her go against the wall all the way. Roll shoulders forward.
Put your hands on your hips and then roll your shoulders forward to the floor.
And then you want to collimate in because I see a lot that's not in her chest. Yes, yes, yes. No, open. Yeah. You don't want to collimate too tightly because you don't want to cut something off and then have to repeat the image. So a little bit extra won't kill the patient. Yeah.
I think I have to do like 1 or 2.
Yeah. Let me see. I would bring it up even a little bit, to be honest. Can you bring it up a little bit? Yeah. No, move the machine up. Yeah, I would do that. Yeah, that's a perfect x-ray.
Okay, so don't move. You're going to inhale, take a deep breath. Exhale, take a deep breath and shoot. Okay, you're all right.